All right. Cool. Okay. I'm going to take my order here and come over to my MAR right here. And I am going to pull up my Ketorolac and also get some normal saline for my diluent. All right. For my order, it is 3 milligrams of Ketorolac, and that is to be administered via IV. 3 milligrams of Ketorolac I calculated as being a safe dose for this patient who is 10 kilograms. The safe dose is 5 milligrams or less, and that's just fine. So when I did the calculation with this 15 milligrams per milliliter vial, I will be needing to pull up 0.2 milliliters of the Ketorolac. So I will use 0.8 milliliters of the diluent, which is just normal saline. And that'll come to a grand total of 1 milliliter, which my rate of administration will be 1 minute. I'm going to be giving this medication at 1800 hours. And I think that's it. Okay, so first thing I'm going to do is take my syringe here and pull up the sodium chloride right here. I'm going to be pulling up 0.8 milliliters. So first I'm going to scrub it for 15 seconds. Okay, so I'm going to take my syringe, pull back 0.8 milliliters, put it in, flip it over, squirt the 0.8 of air in, pull out 0.8 of the diluent, the sodium chloride, and that's all I need to do with that. I'll take the needle off that because I'll no longer need that needle and put that there for now. Next is the Ketorolac. So again, I'm going to do the 15 seconds. Okay. Then I'm going to take my syringe that has a needle, and I'm going to pull back 0.2 milliliters of that. And then I'm going to take it and inject the 0.2 milliliters of air in, and then pull back my 0.2. And I'm making sure there's no air bubbles in there while doing this. That looks good. So then I'll set that aside. Now I'm going to take my Ketorolac in this, with the diluent in this, pull back just a little bit extra space so you've got enough room to put the rest of the Ketorolac in. And then I would put that in and squirt that in there. I'm not going to do that. Okay, so I no longer need that. Now this has the diluent and the Ketorolac in here, and it is at 1 milliliter. So I'm going to take my label I already had made, I'll put that here. So now we've got, my label says 3 milligrams, and it says Ketorolac, because that is the dose we are going to be giving. Now I'm going to be gathering the supplies that I need to take to my room. And that is going to include my alcohol swabs, my flushes right here. I guess I can put this on over my, they're on top of my gloves right here. And then I will need the medication. I don't know if I already said the Ketorolac, but yes, I got to bring that too. So I'll gather all these supplies and I will take it to the patient room. So pretend it is gathered and I will walk to the room. So I walk in, knock, knock, knock. Hi everyone, my name is Mason. I'm going to close that curtain. I'm going to be your nurse for today. And today we are going to be giving a dose of Ketorolac, which is a pain medication, to your child here that has the broken clavicle. I'm going to be talking to the parents because the patient is 2 years old. Some of the side effects that you may notice is just a little bit of drowsiness, some upset stomach, and a little diarrhea maybe. Some more serious possible side effects that are probably unlikely, but they are more serious and they can happen, would be if you notice a rash or your child itching a lot, if you notice any edema or swelling, or if you start to notice any flu-like symptoms like chills, fever, muscle aches, and stuff. If you notice any of those more serious side effects, go ahead and give us a call because those need to be addressed. So what I'm going to do now is just do a quick pain assessment on your child here. The pain assessment we use for people his age is going to be using the FLAC scale. And after looking at the case and what is going on here, looking at your son here, I'm going to give him a score of an 8 on that because he's crying, moving around a little bit, not really consolable, but not quite writhing in pain. He's probably in pretty good deal amount of pain, so I'd say that this pain medication is definitely called for. So I'm going to first ID the patient using the armband, since I can't really talk, and compare it to the MAR that you have in your room. And the armband says James Brooks. Computer says James Brooks, date of birth 530XX, 530XX. Good, 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 good. Okay, so next I just want to check, does your son have any known allergies that I should be made aware of? Anything you can think of? Parents said no. This says no known drug allergies. Sounds good. So next, I'm going to be taking my scanner here, and I am going to scan this patient's wristband, which pulls it up on the MAR, and then I'm going to scan the Ketorolac, the vial of the Ketorolac, and I am also going to scan each of the flushes. Okay, everything clicked and checked out right. So now I'm going to put on some gloves. Alright, so before I start putting stuff in, I just want to check out this IV site here real quick. So this IV site, I'm going to say that it looks good. Looks like there's no swelling, no redness, no problems there. So that is good. So I'd say that we're just about ready to go. So first, we're going to start with this first flush. I'm going to take this alcohol swab and scrub this hub right here for 1 minute. So I'm sorry, for 15 seconds, not 1 minute. Getting mixed up. Okay. So that went well. I can take the flush. I guess I don't need to sit down. Take the flush. And this doesn't need to be put in real slow, but you don't want to slam it in there. And while I'm putting it in, I'm going to watch the IV site, make sure there's no bulging, swelling, make sure that what's supposed to be going into the blood is going into the blood. All right, that went well. So now I'm going to actually put the medication in. We're going to do another 15 seconds here. Okay. And with this medication, since it is 1 milliliter total in here now, I'm going to administer that over 1 minute. So, here we go. Alright, seems to be going well so far. Alright. That went good. So what we're going to do is flush it last because there's still a little bit of medication here in this line. So I'm going to rub it for 15 more seconds. And then we're going to be just about finished up. Okay. And here, this is the final flush, and this is going to be 3 milliliters, just like the first one. But this first milliliter needs to go in at 1 milliliter per minute. The second 2 milliliters can go a little bit quicker. That's fine. So we're going. So I'm going to come back in about an hour or two and try to reassess this pain level, see if we can get that down a little bit. One thing to note about this particular medication is that you cannot take it for longer than a 5-day period. So he shouldn't be getting that because in 5 days he should be leaving. Also, when you go home, I don't recommend giving him any NSAIDs, aspirin, acetaminophen. I'm sure he doesn't get alcohol because he's a young child, but no alcohol. And just no over-the-counter medication unless you call us first and we'll tell you whether or not it would be recommended or not. Okay, so that first milliliter is in, and so with these second 2 milliliters, they can go a little quicker. And as I am putting these in, I am also going to clamp it while I'm still pushing down on the syringe and clamp under positive pressure. Okay, that's good. And we got it clamped. All right, so now I'm going to come over here and get some documentation in and document that I gave him his medication, and he should be ready to go. Thanks.